I just wanted to make sure that you all were aware, and we did change that. There is a collection policy, but we have not done this. We've had a collection policy since, actually '05, where we ask for money. And I just wanted to make sure that you all were aware, and we did change that. There is a collection policy, but we have not done this. We've had a collection policy since, actually '05, where we ask for money up front. When a patient comes into the emergency room, and this is the emergency room what I'm talking about, when the patient comes into the emergency room, they are triaged by a nurse. If they are deemed to be non-emergent, then we are supposed to ask for a certain amount of money up front. This has been a very sporadic thing. Sometimes we do, sometimes we don't. We are going to implement this, and we are going to put a sign in the emergency room that states all patients are required to make arrangements with their clerk once for a minimum of $50 to be required. These are for non-emergent patients. In other words, these are patients that could be seen by their physician or rural health or something like that. So I just wanted y'all to be aware of that.
What y'all want to do?
Why not go up if that's 2005?
Well, we had actually put 100.
She was telling me, I was just questioning, so, do they have 100?
But that's what we all sat down, we talked about, I mean, they're not gonna have, probably, they're not gonna have nurses. Some may not have 50, but they're probably more likely to have 50 than 100, and
Let's see, what that would be.
So what if they don't have that money?
we do not treat them. They are triaged, they're seen by a nurse, and determined to be non-emergent. And therefore, we offer, treatment if they can pay, as they would if they were in a, physician's office. If they cannot, then we do not treat them.
Unless they want to fill out the paperwork so they can.
Absolutely, absolutely. They could fill out the voluntary free care paperwork.
Then bring it back.
What's complicated about paperwork? I mean, it's just their personal information.
It's personal information.
It's not meaning insurance, right? For voluntary free care, they're not gonna have, so it's not like they have to go look up a bunch of stuff.
They have to provide,
They have to provide
tax
some.
returns.
Oh, they do, oh, okay.
No, they
So you
did.
can't just take their word for it?
No. You have to provide some documentation.
Okay.
You have to provide some documentation.
So they have to go home and get it,
Oh,
because they're not gonna bring it with them. Okay.
They don't want to take these.
I don't know, you know what all of it's involved on that, Chris?
Correct, you're gonna have a form fill out, you have to have proof of income of kind of what you have, and in fact, I had a pretty lengthy discussion this morning. Three or four people they just don't wanna, well, I'm not telling you I'm sure.
Yeah,
Well,
they don't, it's like we're an invasion of their privacy.
right. To some degree, if you can pay for something, you can, I can pay for this, or prove that you can. It's a real simple process, and we'll approve it. And just what I've seen, the biggest thing is I don't want to say how much I actually make and then be able to prove it. I just want to say I need it for free.
Because they're off the books.
Well,
They're not reporting their income.
Well, some of them are reporting their income, and they don't want to tell us what they're reporting.
It probably is more than income guideline.
Right.
you only have to volunteer to report.
Yeah.
Right.
Okay.
So,
But-
it's
Okay,
complicated.
well, go back to this one, you think that that's sufficient? Because I was just
Well,
wondering.
we had, several of us talked about it, and said, well, let's see how we can go, if consistently we ask for the fee, maybe do that for a while, and if that, we can use that.
But it's
then
been
we can
effective
go
ever
up.
since we started it.
It was, actually, in 2009, in April 2009, it went up to 100, but I don't think it's ever.
But they never put a sign up.
and nobody ever enforced it. Or-
Do you ever get 100?
They said this weekend they collected money this weekend. Because I think they were very busy this weekend. I didn't ask them that much, but they said they were able to collect some money this weekend. Anyway,
Okay,
But this
thank you.
will obviously cause some
yes.
hard feelings with some
It's
patients
going
that
to.
customers coming here.
Well, okay, thank you.
If it's a
If it's a
child,
child, does it matter?
That's the hard part. I mean,
Yeah.
that's the hard part. I mean, because many of the things that we see, and Joyce will probably address that more, because I've not ever been a nurse in ER, but from what I hear, a lot of times in our emergency room, it's something that could have been taken care of by the physician in the physician's office or rural health or something, and if they, have had this for 5 days, that's not an emergency. If you come in with a spider bite that you got 5 days ago, it's not an emergency. It may be at the time, and that's tough. That's real tough. Hospitals are, we have compassion, and yet, we have to operate as a business, and so it's a real fine line there.
I think it's almost, I think from my experience in nursing, the nurse makes the decision whether it's emergency or not. And they err on the side of
Help the people.
compassion
Compassion.
most of the time.
Most of the time.
I think it's gonna be real important that other options of voluntary care and Magnolia Medical Clinic are given to the patient at that moment in time and not
Not
later.
just cold.
Right.
I
That
agree,
has to
I
be-
agree.
That has to be sort of seamless.
Yeah,
The same people who offer people the option of voluntary